Oh,
Hi, I'm Vina, and I'm here with Dr. Al Costanza, functional medicine clinician and educator.
Okay,
Could you tell us a bit about yourself?
sure. I've been in practice as a functional medicine clinician and naturopath for 36 years. I started when I was 12. No, I'm just kidding. I started when I was 38. And I work anyways from 5 to 7 days a week. And I love what I do, and I plan on working another 10 years,
Wow.
basically.
And not many people can say that. So, all right. So
All right.
here today we're talking about Fungal Remove and Rescue 8, which is a custom-made formula by Dr. Al used to treat fungal infections such as candida, yeast infections in women, as well as athlete's foot, mold exposure. But Dr. Al, I don't have any of those in particular, but I could still need this.
That's
And
right.
please share with us the interesting method in which we can
Sure.
determine if we need this.
All right. Tomorrow morning, what I'd like you to do when you get up before eat and brush your teeth, I want you to spit into a glass of water. And over about a half hour or so, I want you to observe it. Does it float? Does it get stringy? Does it get sink or cloudy? If it doesn't float, if it gets stringy, sinks, or gets cloudy, that's often an indicator that you've got some kind of yeast fungal infection. I also want you to get a flashlight and look at the back of your tongue and or some in a mirror, or have someone look at it. And if you're seeing this white lumpy stuff in the back of your tongue, that's another indication that there's a yeast and fungal infection. So in other words, the reason I bring this up, because you'll treat it topically, whatever you see on your toenails or your skin or whatever, but it's actually systemic. It's within your digestive system, so you got to treat it both ways.
Okay. That's really cool. I'm gonna go do that when I get home.
And how are we going to do
that? I'm gonna do it. No, that'll be fun.
Okay.
So just say I see all of that, the stuff in the
Yes,
back of my
right,
mouth, and
right.
just say I see that,
Sure.
and I start. So what does that mean for my body? Like, what's going on in my body? Sure, I have
Sure.
fungal infection, but what
Right.
else is being affected
Okay.
by?
Well, basically, your immune system, 70% of your immune system is in the gut. When I say the gut, I'm talking from the sinuses down to the other end. So it's increasing inflammation, and inflammation is associated with all chronic disease. So in functional medicine, we get to the underlying issue. It's also going to affect the body at the cellular level. Cells make up tissue, tissue make up organs, organs make up you. So you don't want to just manage symptoms, you want to get to the real underlying problem. And there is a connection with fungus and also cancer indirectly. There was an Italian oncologist many years ago wrote a book, Tullio Simoncini, that cancer is a fungus, and he was ostracized for his work. Well, today they found him, he isn't so ostracized, he was on the right path. Otto Warburg, who was a medical doctor, physiologist, he developed what's called the Warburg effect, because he knows that there's fermentation at the cellular level with cancer again, and this is associated with the yeast fungal infection. So we want to get to the underlying issue, and it will significantly reduce your risk factors for cancer, Alzheimer's, dementia, heart disease, diabetes, and heart disease, so forth and so on.
Okay.
Basically, yeah.
Wow. That makes sense. You want to show it to me?
Yeah, so I developed this formula, the Fungal Remove and Rescue 8, and it's got some pretty heavy-duty herbs in it, that work separately, but they also work synergistically together. And the heavy hitters would be the Podiaco and the wormwood and black walnut hull, but it also has in it some cinnamon, some 2 forms of echinacea, purpura angustifolia, as far as oregano, as one of my professors from Great Britain calls it. He calls it oregano. So, anyways.
Okay.
Yeah, so this is the formula. It comes in an 8-ounce bottle, and with one serving a day of 1 teaspoon, which is 5 milliliters, one bottle lasts about a month and a half. Granted, though, fungus is very, very stubborn. So that's something that sometimes people have to take like 2 or 3 months to get rid of it. So you can treat it topically, but you want to treat it systemically. It was interesting because a couple of years ago, I go once a year for my annual physical, and my doctor's head of internal medicine at Beth Israel, and he noticed a little tiny infection under my armpit. So it was very, very tiny. And he wrote a prescription, and I looked into the prescription, and to find out one of the side effects is liver transplant. Because, in other words, the reason I bring this up because this does work via the liver, but with the herbal formula, no one will ever die, no one will ever need a liver transplant or anything, or any kind of side effect. The only side effect someone might have if they take it on an empty stomach and they've got a sensitive digestive system, they might feel it a little bit, but other than that, we've had no complaints with it, and I've been prescribing this for years, and it's helped patients with that. But once again, my doctor was on the right track because he said this works via the liver. But then when I looked up, and I never took it, of course, and I ended up using my own formula, and within about a week and a half, it was gone.
Wow. So I actually have taken this before.
Okay.
Yes.
All right.
Many years ago. So
Okay.
I lived in an apartment, and it developed mold.
Yes, mold.
Without realizing, there's a wet area, and you move the bookshelf, and there's mold all over.
Yeah.
So I had a terrible cold and all of that, and I looked it up, and I was afraid because they say that mold exposure can affect you like the rest of your life once it happens once.
Oh, yeah, especially
I was
in your
very
lungs.
sick. Yeah, so you did give me this, and I did take it. And there was it was like an insurance policy for me. Like I felt like, okay, I've done something about this that I believe in. That works. So another thing I like about it is that it's a liquid. I mean,
so it's very bioavailable to you.
Yeah. I would just put it in a little bit of juice or something in the morning and drink it.
Yeah.
So very easy.
Sure.
Yeah.
Sure.
Okay. Well, so if anyone wants this or any of the other 140 plus supplements that Dr. Al makes custom, it's very impressive. You could go on the website by Googling Dr. Al Costanza. Or just contact the office and we'll get it ready for you.
781-246-5041. Or you can also, if you wanted to talk a little bit, set up initial free consultation, about 15-20 minutes. I'm happy to talk to you. We can do it in office, or we can do it virtually on my telemedicine platform. And but this is something very important. You want to nip it in the bud, and and it's something we can help you with.
Yeah, good job.
It's over. Oh.